State of Mental Health Conference of New Orleans Youth, hosted by the Institute of Women and Ethnic Studies, as well as Dillard University's Deep South Center for Environmental Justice. This event is funded in part by the W.K. Kellogg Foundation, the United States Department of Health and Human Services, Office of Adolescent Health, as well as the New Orleans Musicians Assistance Foundation GIG Fund. We are proud to host this event today here at Dillard University, which is designated as a historically Black college and university. HBCUs have a rich history and commitment to the advancement of minorities and playing an important role in the community. It is for those reasons that it is an honor for us to host this event here today. It is our hope that you will leave this conference today more informed and empowered to work with our community and our youth to better meet their needs.
I'm talking about an initiative out of the Joint Center for Political and Economic Studies, and we generally look at the role of place on life outcomes. And this is very important to me because as an educationist, I've always been a little bit baffled by all the reports that show test scores going up, educational improvement on the incline. Yet when you look at all the other data, murder, flatline, ACT scores, flatline, poverty on the rise. And I always say schools are not supposed to improve in spite of the community. They're supposed to improve the community.
Right.
It's too easy to close an achievement gap. I jokingly say, and sometimes I get in trouble for this, but I'll say it anyway. You know, the easiest way to close the black-white achievement gap is to stop educating white people, right? But we don't do that. But we will expel, we will fire, we will suspend, we will abuse. This project gives me some data to look at all these other conditions that make for community wellness. We, as was mentioned, we know that there are vestiges of discrimination and segregation that have profound impacts on your life outcomes. There's too much data to suggest that where you live not dictates, but it certainly influences your overall life outcome. And I'm a firm believer that we all have this vessel of opportunity within us, but we should never discount this notion that your place actually matters. Where you go to school, where you live, where you worship, all these things matter on your life outcomes. And unfortunately, we can't help where we're born or where we live. But we should not have, literally what you'll see, a place right next door, a few blocks down, having a lot more opportunities than the next neighborhood. So what kind of factors we know that lead to health disparities? We all know socioeconomics, residential segregation, occupational risk, health risk, access to health care, differences in health care quality. But then there are the social determinants of health. We all know it's the social things that have much more of an impact on your overall life outcomes. And these are shaped by money, power, and resources at both a micro and a macro level. We're talking not just about what goes on in the city, we're talking about what goes on worldwide. So the ultimate measure of community wellness is life expectancy. How good an educational system is, how good a healthcare system is, how good a retirement system is, all comes down to how long are you going to live and the quality of that life. I can't think of a more important measure, and this gives a sort of dramatic has a dramatic impact. Everybody wants to know where they live and what their life outcomes are supposed to be. So what we found in parts of this city, in New Orleans, of the lowest socioeconomic status and those with the highest risk factors, those places, people live 25 years less than others in the richest neighborhoods. 25 years less. Heart disease mortality in the poorest zip codes is almost 5 times higher than the next highest rate, excuse me. And the mortality rate was 1.5 times for blacks and for white residents. These data always shocks people. We have 14,000 people in the city who are not working nor in school. 14,000, that's well above the national disconnected youth rate. That's the term that is used. 14,000. If an employer hired 14,000 people, that would be the largest employer in the city. It is a school district in itself. If it's bigger than Dillard, Xavier, Loyola, and Tulane combined. So all this notion, and I am a reformer, I say that all the time. If we did miraculously change, made everyone college ready, everyone, we wouldn't have the seats for them. There is a serious infrastructure issue. We have 14,000 people in the city who are disconnected. So where do they go? What do they do? Because people are constantly learning, it's just what are they learning? And who are they learning it from? People don't stop learning. School is our entire city. We compartmentalize school into buildings, but the reality is you learn everywhere. You learn here, you learn walking past a blighted property, you learn everywhere, on buses, on streetcars. So what do people do when they learn? Violent crime is very high, pronounced in those same areas with low life expectancy. And then there are I didn't want to get into this too much, but there are all these school-based stressors. So, and certainly our sociologist, Dr. Hatch, can expound on it if you ever get a chance to talk to her. But much of school reform is about saying that this culture at home is bad. And we're going to reshape who you are with our school. That disconnect, that dissonance that's created causes, incredible amounts of stress. And for those collegians, it's important too because the college retention model is also built around that. We literally believe we're taking you away from your homes and improving you. And there's not a bridge there to explain what college is about, and there's not an honoring of the strengths. There's not an asset model that we use in helping children. Discipline practices, I can't say this enough. We put more kids out of school than any city in the country. We will suspend kids for unwashed uniforms, uniforms that are untucked, you name it, we suspend or expel kids. Special education is a stressor in itself. Know that over the last 30 years, we've gone from labeling kids at a disproportionate rate, which caused kids with real, quote-unquote, real disorders or illnesses not to get served well. And this battle we never truly resolved because we know genetically it's impossible to have 75% of black males all receiving special education services. That doesn't make sense. God sprinkled disorder and normal, whatever that means, pretty equally, genetically speaking. And so we should not see these disproportionate rates of participation in special ed programs. And then there's testing anxiety. If you get a chance, you can always go to my website. I've been on a couple studies that looked at testing anxiety. And that's just not a new phenomenon after Katrina. We've been testing kids for the last 20, 30 years. And we know that causes an anxiety, particularly for those who absolutely need to pass a test because they can't rely on the social capital or human capital to get into college. Violent crime in education, you'll see this. There's a clear connection between your educational level and crime. In some census tracts, is up with as much as 72% of residents without a high school diploma. And unfortunately, if you do not get a high school diploma, I mean, there is a pipeline to prisons. You hear those metaphors, but without a high school diploma, you cannot access the social and human goods required to live a middle-class lifestyle. It's not impossible, but it's coming close to it. Higher crime rates are associated with areas that have more repopulation. These communities where you're seeing lower life expectancies are very frenetic. People are moving between neighborhoods, intra-neighborhood. People are moving back all the time. They're moving around, and that's causing a lot of stress in our communities. Ultimately, you know that we send more people to prison than anywhere else in the world, and it is a cottage system that we developed in order to keep the 14,000 students or youth busy. So let's get on to the recommendations, because this is the most important part. I'm a believer in upstream approaches. We certainly have people who are doing great work on the ground. My brother Joshua Perry, who you heard earlier, and I mean that, brother from another mother, or brother bringing the fire, doing great work, touching students day to day. But we still need an upstream approach. We need to change policies that cause this condition to occur, because it's not by genetics that people are dying younger. It is not. We're not genetically predisposed to die younger. That doesn't make any sense. So what is it? What causes our neighborhoods? And then trust me, I don't like the excuse of we choose to live this way. I've never, and I've come from a lot of these neighborhoods. I've never chosen to live next to someone who shoots people. It's ridiculous. But let's get on to recommendations. We should have a uniform expulsion policy. It makes no sense that one school does this for these set of actions and another school does that. It creates this very frenetic system that there are no accountability measures. Students, in order to improve their school, they're clearly using expulsion as a means to get out. And you can find, I forgot to say, you can find these recommendations in the back of the Place Matters book that you received. Provide training for resource officers, security guards, or school-based police officers. That goes without saying. What was it last year? There's something that occurs every year, but last year it was a second grader who was chained up to the chair, and then the year before that it was the student who was locked up in the pen, and then before that it was, it's ridiculous. We need training because it's really a reflection, and Dr. Sherman can speak to this, it's really a reflection of how we've been hurt over time, where we can take these measures to hurt someone else. We should have an external review of school expulsions and long-term suspensions. And I've never really understood a real reason to expel a third grader.
Please.
Right? We need to eliminate that. But I ran 4 schools, and I can tell you, it was a battle with my principals to not expel primary grade students, to not expel people. And I was one of those folks, unless you brought a weapon or you brought, a truckload of drugs, cocaine, that I wasn't going to expel you because the consequences are so severe. It never matches the punishment. More on keeping students in school. Offer alternatives to incarceration. You heard diversion programs. We need lots of those. Greater disincentives to expel. We do need more in-school suspensions. I remember there was a lot of in-school suspension. Bad behavior does occur. and we do need to treat that. But to remove a kid from school doesn't help anything. It's never been a viable solution, and if you understand the policy, you don't have to give a student who's been expelled or suspended homework. So that even adds on to the problem. Oh, and then that goes to that next point. And we need to conduct annual assessments of the needs of truants and youth who are disconnected. Literally, you can drive around the city and see truants everywhere. And we need to drive around the city and talk to them. Instead of these notions that I love the city's efforts, but this whole notion of rounding up the bad guys and talking to them. There's a lot of trade-offs to that we don't acknowledge. And because people like us in this room deal with the collateral damage of those stereotypes that come about from that. Not that I'm against doing new things, but know that there are trade-offs to everything we do when we're talking about rounding up the kids and talking to them with grandmas and police chiefs. We got to give programs, provide opportunities for those who've been incarcerated. And unfortunately, because we have a captive audience, we should have GED services in every type of correctional facility. It makes no sense to not have these kind of services because people will leave eventually. Youth offenders, we should receive alternatives to incarceration. We know this. We actually have seen a lot of this, a lot of changes after the presidential election or during the last election. And I believe we should automate, well, we believe as an organization, automate the removal of criminal records after 10 years. Address mental health needs of children and families. And this is the thing, we got to have some kind of system in place. And there's a trade-off here that is related to what I just explained with the mayor's effort. But we got to have some system to see if a child actually needs services. So if you are suspended twice for some of the same things, check to see. So we need to create some systems for that. Increase school capacity, make school-based mental health services available to students. And I know IWES is doing great work in this area, but we need more providers who can do this type of work in schools. Unfortunately, it's the schools that don't want these providers in the school because we sort of just believe that only teachers can change a life education. And we know that's just not true. Increase the number of inpatient beds, that was already stated. And we need student-centric policies. I can't say enough, most of the folks who developed these policies have been here for the last 30 years, 40 years. And we haven't proven to do anything right. So I'm actually very willing to hear youth, the voices of the youth and new voices come to the table. Because the same muckety-mucks that ran the school system before are running it again. That's traditional and reformers in terms of the upper-level policy makers. The same Jindal was here before. The Uptown crowd was here before. The same people. We need children's voices in all this. But we also need to assess what they want to do. VELA, tremendous organization doing great work. They actually poll the students to see what's going on in their schools. Tremendous work there. We don't ask the students what's wrong in their schools. And we should actually reward them for it. And we should build it in our school budgets. So in closing, I always say, I hate saying that youth have mental health issues. I mean, they are just responding to the policies and the institutions that are in their environment. They're not crazy. We are. I mean, serious. You know, when you're looking at third graders acting out in this way, that's a manifestation of us as a community, as institutions. And then unfortunately, it takes showing life expectancy as, that bad to get people's attention. Where, the reaction to these crazy policies have been killing us for years. You know, bad policy will kill more brothers and sisters than a gunshot any day of the week. So we got to understand that this is not their fault. They are just responding to the stimuli that's presented to them. And so I hope you look at the report. Go to OrleansPlaceMatters.org, sign up. The Twitter is Orleans Parish, at Orleans Parish. Sign up, because we need, when the time comes, and it will, when we need to fill City Hall, we need to go to the Capitol, we need you there. So, and I really want you to get on your smartphones or your dumb phones, whatever you have, and to sign up now.